Hi everyone, this is Dr. Allie Gosnell from Reshape Physical Therapy here in Winchester, Virginia. This week we're going to talk about plantar fasciitis. And today specifically, we're going to talk about what plantar fasciitis is, some common signs and symptoms, and then some causes of plantar fasciitis. And later in the week, we'll talk about some self-treatment and some exercises that you can do to help increase your symptoms. So let's get started. What is plantar fasciitis? Well, it's irritation and inflammation of a thick band of tissue called your plantar fascia. And it runs along the bottom of your foot, goes from your heel all the way to your toes. Some signs and symptoms people usually experience is that their first few steps in the morning feel stiff and painful. But then as they get moving, their symptoms usually end up getting better. But these people may also experience then at the end of the day that their pain and stiffness comes back. Or after long periods of walking or jogging or intense activity on their feet, that their pain and symptoms come back with that too. We typically hear that people feel better when they end up doing massage, icing, or even stretching. So, what are some causes? Well, there are quite a few. One is that you had an accident or event that may have irritated that plantar fascia by landing really hard, falling off a curb, other things like that. The other is that we typically see weakness or stiffness and tightness in the foot. And there are a few foot positions that can cause this. We see it in people with high arches or pes catus, and then we also see it in people with flat feet, so pes planus. And both of those positions can lead to that plantar fascia getting irritated. Pes catus, or high arches, can't absorb shock well. So then that plantar fascia ends up taking a load because those muscles in that foot can't absorb shock very well. Where on the other end, pes planus isn't able to stabilize your foot very well, so it makes it really hard to push off. So flat feet makes it really hard to push off and stabilize your foot to take off during jumps, during walking, other things like that. And so the plantar fascia ends up acting as a supporter and becoming irritated because it's trying to stabilize the foot when the muscles aren't doing it. So those are common things we see. Now, if you end up having pain for 2 weeks, stretching doesn't help, massage doesn't help, ice doesn't help, then I would say come in and see a PT. But if you haven't had pain for that long and you want to try a few things out, tonight until we talk a little bit later this week, look and see how you stand on your feet. Do you stand on the outside of your feet? Do you stand with your arches collapsed in? And if you do either one of those, pay attention to it, because later this week we're going to talk more about foot positioning and how holding a neutral foot can help your foot symptoms. So until next time, pay attention to the way you stand on your feet, and if you have any questions, shoot us a message below. Everybody have a great day.